Sorry. Okay, so the concept of passive activation approaches, just trying to show relational motion as well.
Stop squeaking.
Yeah, yes, there is a dog squeaking in the background, but I appreciate it because that means the dog's not bothering me. You can move both sides, right? So you can move the side that you find the restriction in, or you can move the other side of the joint. So the wrist is an easy place to show this because all of the activation of forces are available. Compression, distraction, torsion, and shear. Same is generally true in the foot in relation to the leg. However, the movement characteristics are a little bit different, but you can move both sides. So just to show and try to make sure that it's somewhat visible on the camera, right? This is not necessarily the hold that I would take in most cases, but we check our deviations, okay, somewhat stiff in both directions. I expect less movement here, more movement here, but when we do this, do you feel some tension pop up in there that's not comfortable? No? Sweet. Okay. There we go. Right, so this would essentially be, this is side bending more than anything else if you want to use common terms. Shear would be sliding, right? So it's not necessarily the same, but torsion is just twisting. So twisting the hand in relation to the forearm, or holding the hand still and twisting the forearm in relation to it. The challenge is it's really easy to roll over the bones, right? And not actually move them. So it ends up looking much smaller if it does happen. So anyways, just to make this more clear, check the deviations, see what the restriction is. Interestingly enough, this seems to be the restriction, even though she doesn't necessarily feel it. I check other planes. That's more restricted. Now I can generate that torsion, again, more restricted coming this way, but I can get around that to some degree. I can push into the forearm while keeping the hand relatively still, and I add more movement in the direction of restriction. And then the shear, I can pull and push the forearm, because if I pull and push the wrist, I'm a little bit more likely to get radial and ulnar deviation and kind of side bending type deal. But if I use the forearm, I get a little bit more of a shear.
Are you compressing?
Not yet. No, I can add the compression. It adds a little bit of movement, and the distraction just tightens it up. Right, so in this case, compression ends up working relatively well, right? Squeak, right on. There we go. And then let it all off. Let's see, more mobile. It's moving farther as far as I can tell.
Doesn't feel any different.
No, I didn't ask. Yeah.
Because I wasn't looking at the movement the first time.
That's okay. So well, the sensation to the individual that it's done to will always have an end range sensation. So it doesn't always feel different because of the end range sensation. Okay, but does that help it make sense with the squishies?
Yes.
Okay, if you sit on up, and please don't kick the camera.